The information in this video is for educational purposes only. It is not a substitute for seeking professional medical advice or services. The information provided should not be used for diagnosing or treating a medical condition. Consult with a healthcare professional if you are experiencing symptoms or need treatment.
Hi, Chrissy. First of all, I would like to thank you for accepting my invitation to share your experiences about pyelonephritis. I'm sure this would be a great learning experience for my current students as well as for the future students. And I hope my students would really understand and respect their patients. And I also hope that this would help my students to provide best physical therapy experiences for their patients in the future. So I have a couple of questions for you. First of all, tell us about your first experience about pyelonephritis. When did it start? And then how did you know that you were supposed to go to the hospital for this medical condition?
Yeah, okay, so it was about like 2 weeks ago today. I just was feeling kind of off, and I had been feeling off for like 2 weeks at this point, so my back was really achy, and I would get like chills, and I was sitting in class, and I got like super, super cold, so I went to go check my temperature, and it was really low, and I kind of got freaked out because my back was really bothering me. Like I couldn't even put my backpack on because it would like shake and my whole stomach, like my whole abdomen would hurt. So I was like, something is going on. My head feels weird. So I was like, I'm gonna go in to the urgent care to see like what's going on because this is not normal.
Okay. So what happened at the urgent care? Can you tell us about it?
Yeah, so when I got there, they brought me into just a little room right away and they checked my heart rate, and my heart rate was super high. It was like 150, and that's like not normal. So then when they saw that, they just sent me right back to the emergency room. And once I got back there, I talked to a couple PAs, and they all thought that I maybe just tore a muscle in my back. But just to be safe, they had me do a blood sample test and then a urine analysis. And they also did a Murphy's test on me, so they hit me in the back really hard. And I had a bit of a reaction to that. So then I just sat there and waited until my results came in, and they found my urine to have like a lot of bacteria in it. And then my white blood cell count was very low. So that like is a sign of infection. So they kind of figured out from that it was pyelonephritis because it's been going on for like a week or two before I went in. So then they diagnosed me with pyelonephritus.
Okay. Have you ever heard about Murphy sign? Are any of the symptoms that you mentioned here before you were diagnosed with pyelonephritis, or before you were going to the urgent care and then ER?
Yeah, so I had heard about like just infection and like the different red flags of infections and like things to look for, kind of like the malaise and not feeling like yourself. And that was like the big one that I was feeling. And then the fever for a while, I was kind of in and out of like having like chills all the time. And those were two big things. And then the aching pain that wasn't going away with doing anything, like I was using a hot pack on it and it wasn't going away. So when I kind of put two and two together that something bigger was going on from that. And those are a couple things that I learned about in class before going in. And then after going in, we learned about the Murphy's test in class, which was kind of cool to put all of them together and be like, you know what, that's what they did to me. Like that was exactly what happened.
Yeah, okay. So that's really interesting. So the pain when you mentioned, and also a fever you mentioned, right? What kind of a fever was that? Was it low-grade fever or was it really high? And when the pain comes, is it only on one place? Would you tell us more about the pain? How was the pain? Where was the pain? And kind of like, the intensity, whether the pain comes and goes. Tell us a little bit about that pain.
Okay. So first, my fever, it wasn't high, which was kind of odd to me. It was a low grade. It was 95 when I checked it at home, and that's what I was like, okay, I gotta go. But then my back pain was kind of on and off. Like if I could get in a position where I would be comfortable, it would go away for a little bit, but I could still feel it like at a 1, kind of just like this weird achy feeling. Like I would find myself like avoiding sleeping on one of my sides, or I would like not want to hug people, or like my dogs would come when I'd come home, they'd jump on me and I'd be like really hesitant, and usually I'm like all about my dogs greeting me. So that pain would, when I'd like get hit in the side, it would like go up to like a 7, and it would go like through my stomach. It would stay in like relatively the same spot on my back, like mid to low back. But it was just very like weird because it wasn't like sharp. It was just very achy, and like I felt like I kept getting like punched in the inside, and it would go from my back all the way to like my belly button.
Okay. So when you mention 1 and 7, when you're referring pain, just wanted to make sure that when you're referring pain, you were saying 1 out of 10 in the beginning, and then it can go all the way up to 7 out of 10.
Yeah.
Right?
Yeah, so when I just was like doing nothing, I could feel it, but it wasn't like bad. I just was like, that's really annoying. Or like maybe it was a 2, I don't know. But then like when I'd get hit, or if I'd like put my backpack on or someone would hug me, it would go up to like a 7.
Okay.
Yeah.
Does the pain go anywhere else, or you would experience only at the just one side, or would that change? Would that change to a different location, or just one particular side?
It just was pretty much on the one side. It was on my right side. I didn't have it going onto the other side of my back. It just was the right side.
Okay.
But it was kind of like a large area. Like it wasn't just like this. It was like a large portion of my back.
Okay. Okay. Yeah. So I'm a little bit curious about your personal behaviors, to know more about maybe alcohol use and smoking. Have you ever used any of them before?
No, actually, I have not. I always tell my doctors I'm kind of boring, but they seem to like that.
Okay. Okay, that's good. That's good to know. Any other medical conditions before or after when they diagnosed pyelonephritis?
No, not
Any
not
significant?
Really. No, not at all, really.
Okay. Has anyone have this condition in your family or your relatives?
No.
Okay.
Yeah, not that I know of.
And anything that really helps you reducing the pain, and also something that really worsens your pain. Anything that helps and worsens?
Yeah, well, I found when I was staying hydrated, my pain like would usually be lower. I wouldn't get up as high, and it wouldn't get agitated as quickly. So like I guess drinking water for me was really big. And then, I'm sorry, what was the rest of that question?
Anything that really makes it worse.
Anything that makes it worse. Like just getting hit or like bumped, it was like the worst feeling. I don't know how to explain it, but I would just like kind of quiver away from people.
Okay. Do you still have that fear when you don't have any of pyelonephritic symptoms?
Yeah, I've kind of noticed it. Like I'm like very hesitant to like lean in with this side now. I'm more like left. I'll like lean in things to my left side, or like I'll step with my left foot forward instead of my right foot. And it's just been kind of odd like watching ever since that changed, because I'm right-handed, so usually everything's like right-handed. But because the pain was on my right side, I think I'm like try to guard it a little bit, even though I don't have any pain there.
Okay. Okay. Yeah. I was a little curious on that. Any medications that helps you?
So I would take Tylenol for pain to reduce pain. So I guess that would be another thing that helped with the pain. I was taking like 2 like 500 milligrams of Tylenol like every 6 hours or whatever it says on the bottle. And then they also gave me Bactrim, which is just an antibiotic. And usually they give it for like a shorter period of time. But because I had it for like this pain for so long, I went on like a 10 to 14 day like antibiotic treatment. And that seemed to help a lot. Like after 5 days of the antibiotic, I wasn't having back pain as much. Like it still was there, but it never got up to the 7. It was like 4.
Okay. And you said, you mentioned that your lab report came with positive infecting bacteria. Is that right?
Yeah.
Yeah, okay.
Yeah, they found like
Okay.
E. coli.
Okay. How's this affecting your does it affect your education? If that affects, how would you manage that? How are you managing it?
Well, now it seems to be good.
Okay.
But like for the 2 weeks that it was kind of like, I'm like, there's something wrong with me. I was either anxious about like what could be wrong with me and I wasn't able to study, or I was just very uncomfortable and I couldn't like sit up for that long.
Okay.
I would have to like lay down or take a nap or something because my head would hurt or my back would hurt really bad. And now looking back, I didn't know that I had the kidney infection going on. But now that I know, I'm like, okay, that's why I was having a hard time focusing and a hard time like getting a lot of stuff done in one sitting because I was in pain. Like there was something wrong with me.
Yeah. So when you went to ER after the diagnosis, has anybody prescribed or suggested physical therapy or exercise?
They didn't really mention anything to me about it. They just said like when I can start moving again, just like do light exercise until I am feeling back to myself.
Okay.
So yeah.
Okay. Okay. And so do you mind sharing us with your physical activity look like? Like how many days? Do you do any exercise? If you do, how many days? And what kind of exercise that you usually do in a day, in a week?
Okay. So I would say when I had it, like when it was really painful, I wasn't doing anything. So for like 2 weeks, I like wasn't running, I wasn't walking, but usually I run and walk like every day. I either take my dog for a run or a walk, and that's usually what my exercise consists of. So it's like a 2-mile run or walk every day, and that's what I do.
Okay. I hope you feel better, and then you started continuing your exercises.
Yeah.
And
Yep. I was able to start doing that again, and it's been really nice.
That's great. That's a great information. And anything else do you want to share with us? That
I don't know.
related to pyelonephritis? Anything else?
I don't think so.
Your
I guess
experience? Okay.
I could mention about my class that here and how like just having it class and like being exposed to like all these different things and like the red flags. I was like, I'm checking boxes and I don't know why I'm checking boxes.
Okay.
To like sign that I have something wrong with me. And then it was kind of interesting to see how like accurate those red flags are that we've been learning about in class and how it can really like make a difference if you pay attention to those or not. And if I would have like been more on top of it, maybe I would have gone in a little earlier than 2 weeks later.
What class was that? And then I know you were at UW, so what class was that?
Oh, that
what program was that?
Yeah, so it was my physical therapy program we did in my pathophysiology class. We talked about red flags, and then also in physical therapy examination, we talked about them as well.
Okay, good, great. I hope that your classes are helping you. So thank you so much again, Chrissy, for your time and sharing this really valuable information. I hope you'll be able to acquire more information related to pyelonephritis when you're at UW. And I also hope that this information would help you make your life better, and also when you go into the clinic, when you're treating your patients in the future, this would help them as well. Okay.
Yeah,
Thank you so
definitely.
much again for coming and sharing your experiences.
Thanks, I'm happy to do it.
Okay.